Hey there. We talk a lot about workforce development here. Obviously, it's the theme of our podcast. And it's always a privilege to spend time with people who have dedicated their careers to advancing healthcare professions on the development side. With so many challenges facing professions like nursing, real solutions for building a sustainable, future ready health workforce are critically needed. That's what we unpack in this episode today with Geoffrey Roche, Senior Vice President of Healthcare Solutions with Risepoint and former Director of Workforce Development for Siemens Healthineers. Geoffrey touts himself first and foremost as the son of a nurse, and he has a great story to tell us about his mom's journey into nursing that continues to inspire the work he does today, building workforces in healthcare, both here in the US and globally. So let's jump in. This episode starts now. In this podcast, we're setting the table for some powerful discussions with nurses, allied health professionals, regulators, tech innovators, and other thought leaders across the globe. Welcome to Care Anywhere, the Global Health Workforce Podcast, brought to you by True Merit. Hi, everybody. Welcome back to Care Anywhere. I'm your host, Lea Sims, and I am joined today by Geoffrey Roche, who is an expert and thought leader in health workforce education and training. And so we're going to spend some time today talking about the future of healthcare workforce, not only domestically, but globally, and what the impact and role of technology, which we all know is transforming healthcare, bedside care delivery, curriculum development, training in the classroom, so many things. So we're going to talk about what the implications are and the opportunities and challenges of that. Geoffrey, welcome to the podcast. I'm so glad to have you here with us today. Could you share with our audience a little bit about you and, what you do? And then we'll jump in.
Yeah. Thank you, Leah, for having me and obviously for the incredible work that you do. I know you've been an icon and trailblazer in so much of this
Oh,
work for so long. And so,
thank you.
heard that from so many of our mutual colleagues and friends. Obviously, Geoffrey Roach, known on the LinkedIn community as the son of a nurse,
Yep.
particularly have had the privilege of working in hospital administration, spent a few years in higher education, all focused in the healthcare academic space, really growing healthcare academic programs to meet industry needs. Then spent some time in the ed tech consulting space, and then obviously have the privilege of leading an inaugural role and really building out for the first time at an organization called Siemens Healthineers, a workforce development program. And then just recently actually transitioned over to an organization called Risepoint, which many people will remember the historic organization's academic partnerships and Wiley. They came together to form Risepoint. And that work is all focused on how do we build both and support academic institutions with healthcare employers. So really bringing the eds and meds together to solve our industry challenges through the academic solutions. And I'm leading all the healthcare work in that space. And so all the nursing pre-licensure work and anything healthcare, I have the privilege of leading in that work as well.
Well, it's certainly an exciting and timely space to be in right now when we could spend a lot of time and probably will talking about shortage and burnout. We talk a lot here about, the distribution of health workers around the world, maldistribution in some cases, and many actually. And what the access to technology challenges are. I know we'll unpack a lot of that today, but I love to ask our guests, typically when we have nurses on this show or health workers, I always ask them, how did you get involved in healthcare? Was there a specific inspiration? And you led with that you're the son of a nurse, so I know that there's an affinity there relationally. Talk about how you found your way into this niche space of healthcare education, specifically from wherever you started out in your career.
Yeah. So certainly, my mother played a big role. In fact, I tell people all the time that I can vividly remember attending my mother's graduation when
Oh,
she
wow.
earned her associate's degree. I was 5 at the time. My brother was 7, and my grandmother, who immigrated and brought my mother and my uncle to America in 1963. I can just remember how proud she was to see her only daughter achieve her dreams of becoming a nurse. And ironically, my mother had a vision to become a nurse earlier. Started in right after right after high school, and then dropped out because she just wasn't able to do it. And then to come back and do it after having 2 children as a single mother and achieve those dreams was really powerful. But I always remember that moment
Yeah.
And, throughout my, elementary, middle, and high school, I didn't ever think I would work in healthcare. In fact, I thought I was going to go into government. Worked in state government at an early age, loved politics, did my undergrad in political science. And it was actually my academic advisor who has now passed who said to me, look, it never hurts to try something. He said, you obviously know healthcare because of your mother. Let's just do an academic long semester. You have a whole semester that you don't have any more courses to do. Spend some time in a hospital and see if you like it. And I did. And what I found was it was just such a plethora of opportunities from a leadership standpoint, from a
Yeah.
growth standpoint. And so I spent a time in, semester just learning. And then when I graduated, it was like, well, this is a great opportunity, strong benefits, great organizations to serve in. And so landed my first job as a community relations coordinator. And certainly my mother's influence was paramount in that.
That's amazing. Yeah. And then talk about how you navigated into education and workforce development specifically, because that's
Yeah.
really the impactful place that you sit now. And like I said, timing couldn't be better. I mean, honestly, workforce development solutions and tech enablement is, top of mind for everybody across the delivery system right now, both here in the US and globally. So, certainly critical. How'd you end up there?
Yeah, so it was actually during my time at my hospital system, which was Pocono Medical Center, Pocono Health System, now part of Lehigh Valley, and then Lehigh Valley is actually part of Jefferson. But during my time there, early on in my tenure, we as an organization had a lot of academic partners and had a lot of challenges. And our CEO at the time really charged me because of my role over community relations to look at how we would better relate and connect with our academic partners. And instead of being a more transactional relationship,
Sure.
what could it mean if we became true strategic partners? And it was really beautiful. It was the first time that I got to see, working with our chief nursing executive, understanding the challenges of clinical placements, working with our chief human resource officer and the HR team, understanding all the work that occurred from articulations and affiliations, et cetera, and really understanding that we were very transactional. We weren't building a relationship, and we certainly weren't taking what was our future workforce and really best preparing them for what would be our future workforce. And so
Yeah.
it was really in that experience that brought me to build with an incredible team the first collaborative at the time in the Commonwealth of Pennsylvania that had a hospital and an academic institution where we shared leaders from both sides and created a learning laboratory. And we redesigned curriculum, we redeveloped, we launched new programs, but it was actually industry and the university
Yeah.
doing it together. And
That
then,
seems like a model, a no-brainer kind of model to me. Like, shouldn't that have been happening already? How can you how can you fine-tune your curriculum if you're not working closely with workforce
yeah,
employers and providers to say, "This is what we're seeing. This is what we need to see coming out of the education pipeline." That seems like it should be a model for everyone, but I'm assuming that's not always the case.
it isn't. And, I think having now worked on both sides, it really takes leadership
Yeah.
and it takes sometimes difficult decisions. So even in that model that I laid out for you, there was a period of time where the dean at the nursing school wasn't willing to even consider curriculum changes. And I went to our president and CEO, who was a nurse, and our chief nursing executive, and I said, look, I know this is a difficult recommendation, but here's what I'm going to recommend. We're going to have to discontinue our academic relationship with them. And our CEO looked at me and said, but all those nurses, all those future nurses.
Right.
And I said, I get it, but don't you think if we do this, it will motivate a change? And she said, you know what? I asked you to lead this. I'm going to let you lead it. And so we did. And, hours later, the provost called, the president called and said, hey, what do we need to do to get back to the table? And ultimately we did, and we got it solved.
Yeah.
Sometimes you've got to do those things. And I
Yep.
think, you know, in my experience, having helped launch medical schools and nursing programs and a plethora of other things, we got to get, to your point, industry leading the way.
Yeah.
Ultimately, industry has to lead the way. Academic institutions are there to be a solutions provider and a supporter. And
Yeah.
so when people talk to me about the crisis or they talk to me about the workforce, I actually regularly say, I point at industry because industry needs to be the one to say, where do we need the support, and then guide the support to get to where they need it to be. And so that's what I've always found in my time.
Well, that's where care model evolution is taking place. That's where tech enablement is taking place. That's where care delivery transformation is taking
Mm.
place. It happens there first, and it needs to work its way backward into education, training, and curriculum modification in so many ways. But I think there's probably always been this traditional model of here's the nurses we're preparing for you, or the whatever the health worker might be, because it's probably true in other health professions as well, what you're describing. And the transformations happening over here at the front line. It's similar to the job task analysis you would do for developing a competency framework or a certification exam. You've got to what are the requirements today for this nurse to provide care in today's environment with technology and all regulatory compliance,
Yep.
which changes constantly. Yeah, so it's interesting that you brought that up and the work that you're doing there. So let's pivot a little bit. I'd love for you to share with the audience some of the work you did with Siemens Healthineers. I love that name because it makes me think of the Imagineers at Disney World, which I'm sure is some of the thinking there. But it's that entrepreneurship, innovation minded, probably a lot of nurse led innovation and design thinking in there. What were you focused on there, and what were some of the outcomes that you can share?
Yeah, and let me say, having, as having been in this space, right? Oftentimes it's an incredible experience when we get to be pioneers in so much of this work. But the opportunity that I had to really pioneer along with my colleagues at Healthineers to really think about how would a global med tech company engage in this space was, truly a once in a lifetime opportunity. And
Yeah,
I'm incredibly thankful, to the leadership there for it. I think one of the things that I applaud about Siemens is that at a global level, even Bern Montag, the global CEO, just recently had posted about on LinkedIn how challenging globally the workforce shortage issue is. And
yep,
in many ways, I think, when you think about a leader like Dr. Montag doing that, that can move stocks. It can certainly move a lot when he comes out and talks about that. But what he's highlighting there is, Siemens is really, doing trying to do its part to really think innovatively, to leverage the power of, normally being a technology equipment developer, enabling services that provide access to care. But ultimately, without the people, all of that means nothing. And
right.
so, for many years, Siemens as a company has had a very robust approach to the idea that, when we enable technology that provides access to care, we also have to think about enabling the professional
Yep, the health
who
worker.
ultimately is the real reason that care is provided.
Yep,
But as time went on, the challenges became, so much more real.
mm,
And, as many know, Siemens launched a program called FlexForce where, they deploy technologists that are trained, highly trained, qualified technologists around the country to serve at different hospitals, like in a nurse staffing kind of, model.
sure.
But the reality of it is that's
Globally, you mean?
yeah,
They're
globally,
positioning them
yeah.
globally,
Yep.
yeah,
But that's like putting a Band-Aid,
right,
on the problem, right? I mean, ultimately, it's like in nursing where we brought nurses from the Philippines and we brought nurses from other places. Yes, that's important, but we also that means we're taking them from their home country, which just further does exacerbate, unfortunately,
yep,
the challenge we have around staffing. We have to be thinking about how you build a sustainable future-ready workforce, and so a lot of the work that I had the privilege to do at Siemens was really to work at the highest levels, certainly at times even globally, but a lot in the U.S. and Canada. Working with government, working with the philanthropic community, working with academic institutions, working with accreditors and licensing boards, working with our national societies to really engage in those difficult dialogues.
yeah,
I regularly think that so much of the crisis of workforce has actually been created by ourselves. When I sat in these licensing board meetings and sat in these accrediting meetings with program accreditors, you know, I'm a big believer and during my time at Siemens have contributed to the idea that we have got to be moving with apprenticeship degrees. We
yeah,
sit at a time in the US where we still don't have the model that allows us to have more apprenticeship degrees in the healthcare space. Yet healthcare by and of itself is designed like so much of the trades. It is truly an apprenticeship type of environment,
Yeah.
yet we still have program accreditors that hold us back and don't allow it. We still have program accreditors and others who are saying, well, you can't pay a student during a clinical experience.
Yep.
Well, guess what? We lose them during a clinical experience at times because they're a single mom or they have kids or they have parents, they've got grandparents. We've got to have a model
Yep.
that allows us to be flexible, nimble, and allows us to support those that want to support us in the future.
Yeah.
And so a lot of my work was around that systems thinking, that design thinking. At times, as I say, like Congressman Lewis said, get into good trouble. Sometimes I think I probably got into a bit too much good trouble,
Yep.
but a lot of it was really around that idea. And I think companies like Siemens and others in this space need to continue to be a big player in moving the dialogue.
Yeah.
And I will say, you know, as a country and as a global society, government needs to play its part. I sit here and still have grave concern um, over, in my opinion, the lack of investment that we see globally,
Yeah.
particularly in these spaces. And whether it's state, local, federal, it all comes back to bite us in the end if we don't invest. And so, as you know, we're moving to a model where care is provided more in the home, more in our communities, and yet we don't have the workforce to literally staff our nursing homes and our hospitals. Yet, where are we going to get the workforce to staff us in these other care models? And so,
Yeah.
that's a lot of the work that I had the privilege to do.
I love this concept of apprenticeship models for training. We do hear more about those globally than you do here in the US. We are still very locked into a degree
Mhm.
requiring system that's very academically gate kept in terms of regulatory requirements. And yet, when we talk to folks around the world in other countries, they're like, "We don't have that infrastructure. We just need people at the bedside learning how to care for our patients." And there seems to be a lot more affinity for those kind of programs, honestly, outside of the US, for sure. Let's talk about, there's so many things that you said there that I feel like we could touch on. The State of the World's Nursing Report just came out from the WHO, a month and a half, 2 months ago, and, what we're seeing in terms of global critical shortage,
Mhm.
they're projecting that to get a little bit better overall, but when you really dig in on those numbers, the maldistribution is gonna get worse. What
Mhm.
is gonna continue to happen is talent is gonna continue to leave those low to middle income countries and move into advanced health systems who are recruiting out of those spaces. And a lot of what we hear, a great deal of that obviously is economically driven. Our position is we want nurses and other health workers to pursue opportunity, have the ability to pursue opportunity, and have portable skills and validated credentials to do that. But we recognize the need for those countries to build resilient health systems. And there's some economic factors there that we can't control, but obviously investment in those programs and the development of training and career pathways for nurses and health workers in those countries is critically important. But access to technology, Jeffrey, is another one that we hear a lot. Like, there are a lot of nurses, particularly, who pursue opportunity in other countries because they don't have the ability
Mhm.
to access and learn and train and use those evolving, you know, tech tools. They don't have the tech literacy opportunities that they can in these other countries. Where do you see that being impacted? And I know that you both at Siemens and probably the work you're doing now is is driven towards providing that tech access and that access to the learning tools that they need that might enable them to stay and thrive and infrastructure build and transform their own health systems if they didn't feel like they had to leave their country to have access to those things.
Yeah.
You touch on that?
Absolutely. I think, and I have a lot of thoughts. Obviously, having now spent time, in the global medical technology space. I mean, look, here's the reality. In my view, we sit at a time where we know if we went to most academic institutions, most training providers around the world, they would tell you we don't have the right technology to train the future workforce.
Yeah.
I've been to hundreds of community colleges, hundreds of colleges and universities. I've taken executives from Siemens and other places, and the reality is it's sometimes it's utterly embarrassing
Yes.
to see what they're training with. And guess what? They can't afford the newest, latest, and greatest. That's not normally in their budgets to do so. And so, at the end of the day, what has to happen then is, I think all companies that are in this space need to come together. This isn't a GE versus Siemens versus Philips. That may be what we competitively have in mind.
Sure.
But we've got to think about a future ready workforce. And whether you train on a Siemens equipment or a GE equipment, let's just remember we need them to train on the latest and greatest so that we prepare them when they get into
Yep.
the workforce. It's just like in nursing. I regularly say, when I was in a hospital administration role, we weren't doing nurse residency programs. We weren't. Our orientation for nurses was far less. And guess why? Because we had better transition to practice.
Yeah.
And we had better ways of managing that transition to practice from college to clinical placement to clinical experience to student nurse to hired nurse.
Yep.
Today, we've had such challenges on that transition to practice that we've had to invest in 6 to 9 to longer periods of time on nurse residencies, millions of dollars. And yet, frankly, where are our industry partners to come in with academia and find a solution that's more nimble, more efficient, and frankly, better for the future professional? And so, this is where, in my opinion, everyone needs to come together.
Yep.
We sit still at a time where industry says they're not coming prepared, but yet, what is industry doing to get them prepared?
Yep.
Figure it out. You can't tell me multi-billion-dollar companies can't find a way innovatively to do this. In my opinion, you can.
No.
And I think it can be done globally. I think it has to be done globally. In fact, when we think about issues like health equity, which I know in some places in the world we can't talk about as much anymore,
Yeah.
but I certainly will continue to.
Yep.
We've got to do this because lives are at stake. And, from my vantage point, there's nothing more important than we can do in this space. You think about AI, you think about all the new and continued new developments. One of the worst things that I heard during my time at Siemens was I was in New Mexico, and a colleague of mine who was just incredible in asking questions to faculty asked a faculty member, if there was one thing that we could do for you to make your job better, what would it be? And this faculty member looked at us and said, if you could help upskill us to
Oops.
know what the latest and greatest is so that we can actually teach our hospital's future technologists, it would be the best thing possible.
Yep.
And so I remember walking away from that and I took it to our national society and I said, hey, can we convene a group of educators? I want to understand, is this a national issue more than just what it was in New Mexico? And what I learned was it's so national. And so somehow, some way, we've got to solve for this. We've got to
Yeah.
figure out how we help our current faculty be able to impart the best knowledge possible. But it's tough because it's also coming at a time where higher ed is attacked and assaulted in so many ways. Lack of funding ripped away, and so we're at a really
Well, and the nurse educator pipeline is diminishing along with the nurse
yep,
graduate pipeline. They go
yep,
hand in hand. So you're looking at fewer faculty to train and fewer people
yep,
moving into. I mean, on one hand, it's a great time to be a nurse, I think. I tell people all the time because there's never been a time when nurses have more influence over care transformation than now and more opportunities in tech and informatics and all of that. But I do think that distribution of nurses away from the bedside and out into other roles, um, I is creating some of the pipeline issues we're seeing in nurse education and, recruitment and retention. So all of those things I think are impacted. So how do you do that? How do you get the attention of an industry that needs to build coalitions and partnerships with health systems? Because I think it needs to be a 3 three-legged stool. It's the provider system, the employers, it's the tech space that can come around, and then it's the academic space. And certainly, of the three, the schools are the least equipped and able to figure all of that out and do it all on their own. It really has to be, as you said, a partnership with those other groups. Where are you seeing that done successfully? Do you have any um, examples of where that's actually coalescing around good solutions for nurses coming through, those tracks?
Yeah. I think, I mean, so not necessarily in the nursing space, but
Or
certainly
in yeah, health
in the
professions.
kind of healthcare professions. I mean, certainly, during my time at Siemens, some of what Siemens has done with their value partnerships and value partners, which involves, a long-standing deal partnership between a hospital system, Siemens, and then also, as you can imagine, academic partners and other
Sure.
partners within that. Some great success and great results in multiple states within those spaces, and sometimes even getting as far into the middle and high schools.
Yeah.
When I think about though if I think about particularly a nursing example that gives me great excitement is, back to our earlier conversation on apprenticeships. In my time at Siemens, I've been able to visit a lot of hospital systems and just learn, listen, and understand what's happening. And UW Health in Madison, Wisconsin, comes to mind. I mean, their system director there, Bridget Willey, has done a phenomenal job of, I would say, respectfully challenging academia and at times accreditors to say, I, as the employer, know what I need,
Yeah.
and I need you to help figure out the way forward. And Bridget has successfully built a world class career pathways model that starts middle to high school. She's built over 16 youth apprenticeship career pathways where they're hired at age 16, working in the hospital system, growing. She's built a CNA one,
Yep.
so medical assistant to CNA, CNA to LPN, LPN to RN, and launched 2 years ago the first in the nation registered nurse apprenticeship with Madison College,
Wow.
Madison Tech, and just absolutely phenomenal results. I had the privilege of taking an executive team from Siemens there and meeting those students. I met one student who was a youth apprentice, was an MA youth apprentice, grew to become a CNA, CNA to LPN, LPN to RN. And she said to me, I didn't have to pay a penny for any of that education. I've been working here all those years. I'm in my seventh year now. And in the near future, I'll earn my registered nursing degree.
Yeah.
And then I'm going to go right on to get my bachelor's. And what that meant for her and her family was profound. But in that model, Bridget had to challenge the system. Fortunately for her, she was able to get ASIN as the accreditor to actually satellite approve her campus so they could grow the nursing program. But she also had to get her executives at the health system to agree to invest
Right.
in faculty.
That's
And
the
they did.
powerful word right there, right?
Yep.
Invest.
And they
Somebody's gotta
invested.
invest in it.
They
Yeah.
hired faculty. They've grown the nursing program, and then because of the success in nursing, they now just recently launched an apprenticeship degree program in respiratory therapy
Oh,
with
well.
the same
Yeah.
college. But again, with the creditor wasn't allowing them to pay for clinical experiences. And so she said, well, then the program can't exist. And so she wrote the accreditor, and the accreditor agreed to change the model nationally. Um, and so these are the types of examples
Yeah.
where when industry leads the way,
Yep.
mountains can move.
Yeah.
And this is the thing that always frustrates me at a time where we still sit and 2027 is coming, 2032 is coming, all these reports we know about.
Yep.
It's industry has to lead the way,
Yeah.
and industry can't take no for an answer. When
And
the
it's people
accreditor
like that willing to pick up the shovel and go, "If the only way this mountain is gonna move is I have to dig in here," right? I can dig in with my program, I can dig in with the right stakeholders, to change policy, I mean, it's always a process or policy change that you get to that tipping point. These are great examples, and kudos to that program for pushing that forward. I imagine that then becomes a model. Somebody's gotta get out there and do it first, show
yeah,
that it can be done successfully, and, that's exciting. We have just a few more minutes left, but I know when you were at Siemens, just not too long ago, just to talk a little bit more on the global investment side, you guys or Siemens put out some work that you had done with the American Society of Radiologic Technologists, where you're doing some global capacity building,
Yeah.
which is, certainly relevant to our audience. Can you talk about what you guys were doing there and what the
Yeah.
impact was? Yeah.
Yeah. So that actually came as a result of really, ministries of health
Yeah.
in multiple developing countries, specifically highlighting, that we've got to be thinking about how we can upskill and reskill our workforce because in some countries, obviously in the US, you've got to have an associate's degree and pass a national certification to be a technologist. Well, in
Yeah.
some countries, that's not the case, but you do have to have training, obviously. And
Yeah.
so this minute, in multiple countries, Azerbaijan being one, where the Ministry of Health acknowledged that they've got to do more to build this sustainable career pathway. And so they came to Siemens and my global colleagues came to me and they said, hey, there are other global organizations that can help in this space, but we know that Siemens has been doing a lot of work with ASRT,
Yeah.
particularly in the U.S. on this. Do you think there's a way to kind of take what's being done there and just bring it out here? And ultimately there was. And so a lot of that really is focused on, basically a, attracting people into the profession, and then B, providing a platform and a training opportunity that gets them to where they need to be able to operate in that country. Because to your earlier point, yeah, we need them here, but you know what? They
Yeah.
really need them there. And
They do.
ultimately, when we think about access to care, in those countries, this is life changing
Yeah.
for not just the person who's going to be in that role, but also for the patients that are going to receive that care.
Yeah.
And so a lot of it was just focused on a scalable platform to help get to that point.
Yeah. I mean, that not only does that create, training and development pathways, but it also helps to frame out scope of practice.
Yep.
It helps to frame out standards and competency frameworks, potential licensure or credentialing of those individuals in countries where that doesn't exist. Like you said, we see that in nursing too, that,
Mhm.
we are, we care for a number of health professions, but nurses primarily historically has been our focus. And, like you're seeing with radiologic technologists, there's no two countries are the same in terms of how they're trained and whether or not they're required to sit for a licensure exam or a registry
Sure.
exam or any regulatory framework for eligibility to practice. So investing in tech enablement and training, not only does it equip that worker, but it also helps build standards and framework infrastructures in these countries where they now have something to build that competency framework and make regulatory or licensure decisions around, which is as critical to patient safety and provision of quality of care as their education and training. Just being able to validate those skills, I also think it gives the health worker more portability of
Mhm.
their skills if they leave that country or they want to move regionally to work. So there's certainly a lot that is wrapped into those opportunities, but it has to start with someone investing in that kind of, tech-enabled training and
Yep.
infrastructure development. So it's really great work. All right, well, let's, pivot over because I know you just started your new job and you're working in similar function, I think there. What are you working on now?
Yeah.
What's exciting in your pipeline right now,
Yeah.
with Risepoint?
Yeah. So I'm, excited, obviously when I went to Siemens, one of the neat things was it expanded me into the kind of the full ecosystem, but from the tech enabled side to your point. But I'm super excited, for this opportunity at RisePoint because if there's one thing that I've always been super passionate about, it has really been the nursing workforce. And so my primary focus is really to, work with academic institutions and their healthcare systems around the U.S. to start, but will certainly grow further because obviously RisePoint does work in the UK, Australia, and other parts of
Yeah,
the world, and how we better meet the moment of this staffing and workforce crisis, and how do we scale in many cases fields like nursing that have still been historically in person uh, in academics, but the reality of it is you can do nursing online and then do the clinical experiences in person.
Yeah.
And so really, challenging that status quo, thinking more uh, nurse and modern learner first.
Yeah.
And that's something we've got to do in the academic space, is really moving to a modern learner. And I keep saying in the healthcare space, not every learner wants to sit in a classroom.
Yeah.
Not every learner can sit in the classroom. They may have kids, they may have grandparents, they may whatever. We've got to have a model and an infrastructure that supports them to learn where they want to learn, and then a model that allows them to train in a way that gets them to get there.
Well,
And
and you're
so,
also talking about digital natives who are consuming their
yeah,
information completely digitally now. When you see medical programs, even like at Harvard, who moved away a few years ago from a historical model of
hmm
lecture and classroom lecture to no, we're going to point you to
yep,
online
yep,
online videos. Go consume those there and come to class ready for workshopping and discussion. I think that that changes the whole sort of didactics of learning. They're evolving because of the digital ready accessibility of all of that information, textbooks online and video. I mean, this is a generation that's learning differently than we would have in the past. So it's great to see those models evolve with them. All right, to close out, tell me what excites you about the future technology in healthcare coming out of your role at Siemens and what you're doing now. Where do you think tech will have the obviously AI? That's going to be the one everyone jumps into first, but that encompassing, where do you see tech really transforming care delivery and then obviously then greatly transforming workforce preparation for
yep.
that future ready workforce?
I definitely get excited that, I mean, first and foremost, and I know, some people when they hear this will be like, "Oh, here we go." But tech makes me excited from the vantage point that I have always believed, first and foremost, that at least in the U.S., our healthcare system was really designed at a time that was not equitable. And so I get excited to envision a time where technology doesn't see one's color of skin.
Yeah,
Technology doesn't treat someone differently. That it can be more equitable. So that piece
yeah,
gets me super excited for that. To your second part of that question, we've got to continue to find a way to leverage technology to create a more efficient healthcare system
yeah,
for the workforce. And so it gets me excited when I see, A, we've got to invite nurses to make the decisions on what technology is used. Uh,
mm.
I don't know why in 2025 we still don't do that. I love my physicians, but guess what? We need our nurses really to be.
I think we're seeing it more and more. I mean,
We
certainly
are.
more than we did in the past.
Yep.
I'm increasingly excited about nurse-led
Yep.
innovation and the roles that CNIOs and CNOs are playing in
Yep.
tech companies where those would have been physician roles in the past,
Yep.
and now they're saying, "No, we might need someone a little closer to the care delivery bedside, to help us make those decisions." Not to interrupt you, but I do think
No,
it's changing
I
and
agree.
shifting.
And we
Yeah,
need more of that. And so,
yeah,
and the other piece I'll say is, to that is we need to really, I've been saying this for a long time, we need to have nurses on our boards.
yep,
Less than 6% of our health systems in the country here in the US have nurses on our boards.
yeah,
When, we need nurses in, most states have physician generals. We need nurses at the same
yeah.
level. We've got to really, in my view it from the perspective of we know nurses are the largest workforce. Yet, when we ask them, when we engage them, I saw it in my own experience at my hospital system. I served for two different CEOs in 10 years. Our quality of care, our patient safety, and our staff engagement scores were higher consistently under the nurse CEO than they were under the CFO CEO
Yeah.
that had no clinical background. And again, I can't sit here and say with quality evidence because I'm not, a quantitative expert,
Yep.
but I know because I reviewed that data all those years and had to be the one to externally report them, they were dramatically different. And I do believe there's a reason for that. And so that I get excited to your point from that. And I'll also say I get super excited about our future generations because I think when I think about what they can bring into our healthcare system, I just it makes me super hopeful that we'll actually finally have a healthcare system that will leverage and harness the power that does exist within a tech-enabled area, and at the same time doesn't forget who we are as people.
Yeah. Yeah. I love what you said there about nurse leaders. And I love that we're going to land there because that was another outcome of the State of the World's Nursing Report. One of the recommendations there was we've got to have more nurses in leadership. We need them in government leadership roles, critical decision making roles. We need them on boards for both provider or healthcare organizations and tech companies that are going to be leading the way. And excited to continue to see them positioned there. Geoffrey, thank you so much for this conversation, for your passion for the profession, which started at a young age in a beautiful way, a very personal way, and certainly is carrying you through the roles that you've been in and are in now and really making an impact. And we love to talk to people who are passionate about moving the needle on these issues. I know that's a commonly used phrase, but we want to see measurable outcomes and measurable progress. And the examples that you've given today are things you can see are making a difference. And so thank you so much for your investment in the profession personally and what you're doing and spending time with us today on the podcast. I know will be valuable to our audience. So thank you. Appreciate having you.
You're so welcome. Thank you for the opportunity.
Absolutely. All right, guys. Thank you so much for joining us for this episode. We'll see you next time on Care Anywhere. That's it for this episode of Care Anywhere. Thanks for joining us. We hope you'll tune in for future episodes where we will continue these powerful discussions about our global health workforce. If you missed any episodes, you can find them at truemerit.org/podcast or by subscribing to our channel on your favorite podcast platform. Just look for our podcast logo or search for Care Anywhere to find us. Thanks again, and we'll see you next time.